I think it was a goal of mine to go back to school. I hadn't gone to school for over 30 years. I chose medicine because I like helping people.
Being in the medical field is about teamwork and working with individuals that have the common purpose.
The more you educate yourself, the more you can help others.
I went to high school at Green Mountain, but I didn't finish. I ended up getting my GED, and I did attempt college several times.
I think it's important to have a good pharmacy technician because the pharmacy technician is the backbone of the pharmacy.
Just trying to figure out what I wanted to do, and I was actually talking to my dad, and he's like, "Oh, have you heard of pharmacy techs?" And I was like, "You mean those people that are at Walmart?" So I started looking into it, and Front Range has a great program.
The pharmacy technician program at Front Range Community College is an ASHP accredited program.
In the labs and things, you get a lot of hands-on experience, so that's a lot of fun. We get to learn how to make IVs and, compounding and things like that. Front Range definitely paved the way for me to get a job. They were there to help me with, my resume skills as well as my interview skills, and they helped me find that job.
There is a lot of opportunity in the pharmacy tech program where the students can take on-the-job training, and it's usually through an externship when the coursework is completed.
Students will do a clinical rotation at a community pharmacy and will also do a clinical rotation at institutional pharmacy.
Front Range really prepared me to be that pharmacy technician that I needed to be in the real world.
I want to teach in the pharmacy technician program because I want to be able to produce pharmacy technicians that know what they're doing, that have all the skill sets to be a great asset in a pharmacy.
I was very excited to find work in the field. As a pharmacy technician, there is a bunch of different roles you can do. So in a hospital, a day-to-day would look like you're making IVs, you're doing IV batches, making stat medications, filling, Pyxis machines. In a community pharmacy, you're filling medications, you're taking in those prescriptions, you're helping customers and patients. You can work in a hospital, you can work at Walgreens, Walmart, King Soopers, any of those community pharmacies as well. You can also work in long-term care facility. If you're in a community pharmacy, you get to take in those prescriptions, help the patients out the window, and you get to move into filling those prescriptions. So you're finding those meds, you're counting out those prescriptions, you're labeling them.
The program was fast and furious. By the time I graduated and took my board exams, I'd already had 5 or 6 months of part-time work experience.
In this program through Front Range, you have to do an apprenticeship in both the inpatient program and the outpatient program. We were paid to do our hours in our apprenticeship. On the eve of my national certification test, I was very anxious, very nervous. As I was preparing, I don't think there was a day that I didn't go home and hit the books or a night that I wouldn't stay up and study.
Once you successfully take and pass the exam, then you can register and apply for a licensure to practice in the state of Colorado as a pharmacy technician.
I came out of here just very prepared. I took my PTCB exam and passed on my first try.
When I saw that pass on my exam, it was probably one of the best days of my life.
Front Range Community College Pharmacy Technician Program is unique because you can use the skill sets that we teach you in the Pharmacy Technician Program in the state of Colorado or any state that you decide to practice in. About 80% of our pharmacy technicians that graduate from our program are able to obtain a job at their clinical rotation site.
The curriculum here at Front Range is up to date. They prepare you for working out in the field, and they also get you the connections to meet different places where you can work.
My job as a certified pharmacy technician makes me feel very proud. I'm happy to get up and go to work.
Pharmacists are wonderful people to work for. They're a part of your team. They're not really there to be your boss or to be someone that tells you what to do. They're there to be your coworker. They're there to help you through your day-to-day work. Personality traits of a good pharmacy tech is detail-oriented, responsible, honest. We have to have attention to detail. What we do is very, very important, and we have to pay very close attention to what we're doing. You get to see these people that, come to your counter, they are very, very sick, and as you're giving them these medications that are helping them, you continually see them get better and better and better. And that does make you feel like you are making a difference.
Somebody that's considering getting into the pharmacy tech program, I would advise them that it's a good opportunity because our job is stable.
The outlook for pharmacy today is really promising, and especially for pharmacy technicians.
It's a great stepping stone to get into any healthcare career that you would like.
I want to show my children that it doesn't matter, or people, that it doesn't matter your age, that you can still succeed, and you know, Front Range kind of opened that door for me.